My name is Katya Zubreva. I'm a partner in the healthcare services team at L.E.K Consulting. Sadly but understandably, all the issues we talked about over the last year are still there. Treatment waiting lists and backlogs, issues with affordability, clinician shortages, the need to redesign patient pathways and reimagine healthcare delivery, all of these challenges that the healthcare services sector has faced for some time still loom large. Of course, on top of all of that, we now have inflation. Our recent inflation surveys shine a clear light on this. It is hitting in a number of ways. Firstly, for any services that are paid for by the patients out of pocket, demand will be impacted. Healthcare is competing with rising energy costs, fuel costs, food inflation for a share of the consumer wallet, and it is far from immune. The impact will vary by treatment type, though, depending on a few things. Urgency. Is the patient in pain? Will the condition deteriorate if it's left untreated? Importance. Fertility famously holds up better than many others. Overall cost and availability of financing. And finally, whether the patient will pay for the treatment out of monthly income, directly or via financing package, or out of their savings. Secondly, of course, businesses are seeing costs rise. Salaries, energy, consumables, and logistic costs are all increasing as inflation bites. Clinicians and other staff are requesting significant salary increases as their own finances are stretched by inflation. Coupled with shortages of clinical staff across most of the European countries, this puts significant pressure on provider P&Ls. Now, price increases are an obvious way of dealing with inflationary pressure, and our own recent surveys show that in general, people are accepting of increases, particularly in inflationary times. We must, of course, tread carefully to not create more demand issues, but interestingly, there historically has always been a reluctance within the sector to put through price increases. So there is a risk that providers will be too conservative here and absorb too much of the cost inflation themselves. We're doing a lot of work across the sector, helping navigate the demand uncertainty. We're also increasingly getting involved in pricing, as well as broader commercial excellence and organizational design, leveraging both our deep sector knowledge and functional expertise to help give our clients a real advantage in the years ahead.